to Bad and Bipolar once again. This video is on the bipolar medications that I've been prescribed over the years and their effects on me. The first one I want to talk about is olanzapine, also known as Zyprexa. It is an antipsychotic used to treat the symptoms of a psychotic episode. It can be used to treat both bipolar and schizophrenia, and it has to be used in adults or children who are at least 13 years old. Now, the side effects of this are the typical of an antipsychotic. They are weight gain, increased appetite, and dullness of the thought. Now, a funny story, or not so funny, whatever way you want to look at it, when I was prescribed this medication, when I was in the hospital, I was so numb and so dull that I was going to the canteen to get something to eat because that's all I could think about, and I walked clean into a wall, straight into the wall. I had no concept of depth perception or where I was going or what time it was. I just knew I needed to get food, and the nurse had to steer me into the canteen, and then the food just was devoured in 3 seconds, and that was my experience with that. And now when I say you feel like you need food when you're on this medication, I mean it's like obsessive thoughts, like an addict. Oh, I need this food right now. Oh, you've got tiredness, you're sluggish, and also depressive thoughts. The next medication I want to talk about is Seroquel, also known quietapine, so called because it keeps you quiet. No words can begin to describe how much I hate this medication with a passion. It's used for the same reasons as olanzapine, to treat a psychotic episode. It can be used to treat schizophrenia as well. You have to be a certain age to use it. Now, my horror story from this one is similar enough to the olanzapine story, but I had just been put on it for a manic episode, and I had come down, and I was at a depressive episode, but I was still on a high dose, and my family were allowed to take me out of the unit for a Mother's Day dinner, and I just remember my head was going towards the table the whole time. There was food in front of me, but I just couldn't keep my eyes open. Oh, it was terrible. I had to be midway through the meal careened out of the place like a zombie, and people probably thinking, oh, that poor girl, what's wrong with that poor girl? And I was just, I found it caused severe night terrors and sleep paralysis, and now I've talked about those in a different video. If you suffer with those anyway, and then you've got that on top of it, it just adds to it because you're medicated. If you're medicated too high and you're having sleep paralysis, it's just not a nice experience. Extreme dullness, and it is not for me. Now, I would never say to anyone, well, go off that if you're on it, because everybody's different, and I'm not a doctor, and I'm not here to tell people what medication to take. I just felt like everything was slowed down. I had poor reactions to conversations, no enthusiasm, but it is, on a positive note, very good at bringing you down from psychosis. Very, very good. And never stop taking it without a doctor's approval, or you will get withdrawal symptoms. If a doctor tells you you can't get withdrawal symptoms from prescribed medication, he is lying. You get shakes, you get nausea like any other drug, and you will get mania. That is a fact. Other medications I've been on are antidepressants. There's not an awful lot to say about antidepressants, too many to name, but weight gain, but not as intense as antipsychotics. It brought the mood, it lifted the mood up like it's supposed to do, but I found with the bipolar, as opposed to if you were depressed, mainly just depressed, obviously, it brings on mania and mixed episodes, so I was encouraged not to take them anymore and to deal with depression through CBT, exercise, diet, counselling, and things like that. The last category of medications are benzodiazepines, such as Valium and Xanax. I was only given these medications as an inpatient scenario, and I think it was just to keep me calm and keep me quiet. But the thing about these is they are highly addictive. Can easily lead to addiction and abuse, so they shouldn't be prescribed lightly. You feel like, oh, the house is on fire, oh, that's terrible. I mean, you're still aware of everything, but you just really don't care. It's like having a few drinks, and that's why it's so easy to get addicted to it, because if you're a person who worries and panics all the time, and then you're given these to just not feel any worry or panic, then when you're taken off them again, you've got the original worry and panic, and then you've got the, but I need this to help me, like an addiction. To wrap it up, meds are important. Finding the right ones to suit any individual is the hardest part of it. It can be a painful ordeal through trial and error. For years, it took me 8 years to find the right medications. And when you're on the right medication, stay on them. Drink makes it impossible for your medication to work, so don't expect to drink heavy and your medication to work. If anyone's interested, I'm not saying these are the miracle medications, I'm saying these are the ones that work for me. I'm on lamictal, I'm on epilim, and I am on azanapine. So this is what works for me, but leave me a comment and tell me what works for you, what doesn't. And thank you for watching once again.